Today, we're tackling a subject that affects millions of Americans and has been shrouded in controversy for decades: heart disease and the multi-billion-dollar industry that surrounds it. Our source is the eye-opening book, Heart Frauds: Uncovering the Biggest Health Scam in History, by Dr. Charles T. McGee. So, grab a cup of coffee, sit back, and let's explore the truth behind the headlines. Every year, over 500,000 Americans die from coronary artery disease. It's a staggering number, and in response, the medical community has developed a variety of approaches to prevent and treat this condition. But here's the kicker: many of these methods are not only expensive, but also far less effective than we've been led to believe. Let's start with prevention. Physicians often recommend dietary changes based on the cholesterol theory. But here's a shocker. After 40 years of intensive research, scientists have failed to prove that lowering cholesterol reduces the overall death rate. In fact, some studies have shown that cholesterol-lowering drugs can actually increase mortality. It wasn't until 1995 that a study showed a decrease in heart attack deaths with one class of these drugs, leading to the widespread promotion of drugs like Zocor. But what if there was a cheaper, safer alternative? Vitamin E, for example, has been largely ignored by the medical community despite its potential benefits. This raises the question: why are we so focused on expensive drugs when simpler, more effective solutions might exist? Now, let's talk about what happens when heart disease symptoms strike. Patients are often rushed to the hospital, and while emergency care has saved many lives, the approach to treatment is where things get murky. Bypass surgeries and balloon angioplasties are often recommended, but studies have shown that these procedures are frequently unnecessary. In fact, a second opinion clinic run by Harvard cardiologists found that over 80% of these procedures are not needed. The problem? The angiogram, the test used to diagnose blockages, is highly inaccurate. Despite this, it's been used as a major sales device to push patients into surgery. The irony is that an accurate angiogram method was developed in the 1970s, but it's almost like a trade secret. Hardly anyone knows about it, and even fewer can access it. The pattern here is troubling. Procedures are developed and widely used before studies confirm their effectiveness. When evidence emerges showing they're of little benefit, physicians often ignore it. This isn't just a minor oversight. It's a systemic issue that leads to unnecessary pain, suffering, and billions of dollars in wasted healthcare expenditures. But there's hope. Studies have shown that coronary artery disease can be reversed without drugs or surgery. This information, combined with the new oxidation theory of atherosclerosis, points to prevention and treatment approaches that are not only effective but also far less expensive and more humane. So, why aren't these discoveries being taught to physicians? The answer lies in the vested interests of the medical pharmaceutical industrial complex. These entities resist changes that could hurt their profits. Imagine being given a choice between a safe, inexpensive, non-invasive procedure and a costly, risky treatment with dangerous side effects. Which would you choose? Unfortunately, most patients are rarely given that choice. Let's delve into the world of angiograms and surgeries. The ordinary angiogram is not just inaccurate, it's a tool that has been used to scare patients into unnecessary procedures. Studies have shown that experts often disagree on the results, with one doctor seeing a blockage where another sees none. Yet this test continues to be the gold standard, leading to countless unnecessary surgeries. The surgical procedures themselves are not without their problems. Coronary artery bypass surgery, or CABG as it's known in medical slang, is a major operation with significant risks. Death rates vary widely among surgeons, and complications are common. Despite this, the number of these surgeries has skyrocketed, driven by a combination of misinformation, aggressive marketing, and financial incentives. The financial incentives are hard to ignore. Surgeons can make millions from these procedures, and the more surgeries they perform, the more they earn. This has led to a situation where some surgeons recommend surgery even when it's not in the patient's best interest. The story of George G., who refused surgery and opted for diet and lifestyle changes, is a testament to the fact that there are alternatives. The medical management of coronary artery disease has its bright spots, like the coronary care unit, which has saved many lives. But the use of anti-arrhythmia drugs, for example, has been associated with serious complications. The bottom line is that the current approach to heart disease is deeply flawed. The cholesterol theory, which has dominated the conversation for decades, is increasingly being questioned. Studies have shown that dietary fat and cholesterol intake have little effect on blood cholesterol levels for most people. Yet the myth persists, fueled by powerful interests and a lack of public awareness. So, what can you do? First, educate yourself. Read the studies, ask questions, and seek second opinions. Insist on non-invasive tests to evaluate your heart's function before considering invasive procedures. And remember, the function of the heart is to pump blood. If your heart is pumping normally, surgery is unlikely to improve your chances of survival. Consider exploring alternative approaches like the Pritikin program or Dean Ornish's lifestyle changes, which have shown promising results in reversing heart disease. These programs emphasize diet, exercise, and stress reduction, offering a holistic approach that aligns with the body's natural healing mechanisms. Finally, be aware of the financial incentives at play. The more procedures performed, the more money flows through the system. This doesn't mean all doctors are corrupt, but it does mean you need to be vigilant and proactive in your healthcare decisions. In conclusion, the current approach to heart disease is a complex web of misinformation, financial incentives, and systemic flaws. But there is hope. By becoming informed and taking charge of your health, you can avoid unnecessary procedures and explore more effective, safer alternatives. Thank you for joining me on this journey. I hope this episode has shed light on the issues surrounding heart disease and empowered you to make informed decisions about your health. Until next time, stay curious, stay informed, and take care of yourselves.
This has been a BrightLearn video from BrightLearn.ai on the book Heart Frauds, Uncovering the Biggest Health Scam in History by Dr. Charles T. McGee. Visit BrightLearn.ai for more fascinating videos like this one, and visit naturalnews.com for full editorial coverage and breaking news on critical stories that keep you informed and aware of what's really going on.